overdue for an update. And I'm waiting for my nails to dry. So I figured, why not try and film an update really quick while I'm waiting for my fingernails to dry. And hopefully I can get through this and stay on task so I don't have to edit. Because editing sometimes takes a while. So, at the end of May, I got a sinus infection. The previous time that I was sick before that was in November. So it had been a little while. So I wasn't too surprised that I got sick. I was hoping to hold off a little bit longer. It's just the way things sometimes go with me and my health. So that happened. And got better from that. The only thing that didn't change was I still felt and feel like still that my appetite hadn't come back yet. So that's been a little bit concerning, but I was like, I'm sure it's just going to take a little bit of time. And that I was fine. Not too worried about it. So then I saw my pulmonologist. My lungs improved from my previous visit, which was great. And she had done allergy testing 6 months ago, just blood testing. Everything came back pretty normal. So she's sending me to an allergist because we cannot figure out, we need to pinpoint what triggers my asthma and try to avoid whatever is triggering it. So she wants me to do skin scraping allergy testing. So I went to the allergist. The allergist wasn't sure because some of the medications I'm on, they aren't necessarily antihistamines, but they have antihistamine properties. So she wasn't sure if the skin scraping would actually work unless I came off some of these medications, but I can't just come off of my medications that relax my muscles. So what she did was she did a control, a positive and negative on my arm, and I did have a reaction. So she was like, okay, the skin scraping will work. We can do that. And so I'll do that in July. See if we can figure out what is triggering that. She also changed my inhaler that I take every day. And then I still have my rescue inhaler, which I feel like I've had to take more since we've switched inhalers. So we may have to go back to what I was previously on. We'll see. And then she added a medication and took me off of a medication. The one she took me off of can cause a lot of harmful side effects, and so she just felt like, since we don't know if it's helping, why are we taking it? So that's one of those things that we can sort of mess around with and see if I need to try and go back on it and see if it helps, or stay off of it for a little while longer. And so we're just going to be adjusting medications and trying to figure out what works, what helps, and what doesn't as far as my asthma. And then we are also going to do the allergy testing, like I said, in July. So then, big update. I went to the cardiologist just a couple weeks ago. And I did an EKG, and the nurse practitioner came in and she asked if I was feeling okay because she said I looked really pale. I was like, yeah, I'm okay. And she was concerned because she thought I looked really pale, and I'm like, well, I don't have any makeup on. I didn't say that, but that's what I was thinking is, like, I don't have any makeup on, so that's probably why she thinks I look pale. And so it was like, I mean, I didn't think much of it. The doctor came in. He said my EKG looked great. My heart function is great. Next time we'll do an echo, which is like an ultrasound of the heart. So yeah, but everything looked great. Sounded good. And he said we'll just do blood work because... Oh, and I forgot to say, the nurse practitioner, when she left the room, said, I hope you feel better. And it's like, I don't feel bad. You just think I look really pale. So, anyways, and the doctor said everything was great and that we would just do blood work. That's routine. So he did blood work. I got home from the cardiologist. I had been home for about an hour, maybe, and I got a call from the cardiologist, and I'm like, this is strange. And so I answer it, and they said that I need to see my primary care as soon as possible because I am severely anemic, according to my blood work. And this made me very, very concerned because of the way she said it. And I'm thinking, oh no, this has happened to me once before and I was sent immediately to the emergency room. If y'all have watched my story, the My Story playlist, I told y'all I got very sick. But back then, I didn't feel comfortable telling y'all exactly what was going on. But you can read into the reasons. But now I feel like it's something that I have to share because this is something that is going on and is affecting my daily life and is affecting YouTube and everything. So, I am severely anemic, is what they said. And so... the next day, Friday, I went to my primary care. They were closed, and there was a sign on the door that said my primary care would not be back until the 29th. But that there would be a different doctor covering for her through the 26th. So my mom talked to one of her friends who's a doctor and said, can she wait until her primary care gets back, or does she need to see someone? And the person said, no, she needs to be seen. She needs to go ahead and be seen. And my mom had sent her friend the blood work that they sent me and all that. Sent her a picture just to be like, how bad is this? Because my mom is a nurse, and my mom feels guilty that she didn't notice this and catch on to this before now. But my mom is great. She's got a lot going on. So I saw my primary care. Well, I mean, it wasn't mine. It was the one covering. But it was at my doctor's office. And he took one look at me, said, yeah, you're very pale. Yes, you're anemic. I mean, he was even like, your lips are super pale. And I've noticed that more. You can even tell from your nails, apparently, but I always keep my nails painted, so he couldn't tell from my nails. But, so that was, he didn't want to do any more blood work because I'm already so anemic. We took my blood work and I showed it to him, and just already being so anemic, he didn't want to draw more blood and make me even more anemic. And he referred me to a hematologist. So there's a place here in Memphis called West Cancer Center, or West Cancer Clinic, something like that. So that is where I was sent, because apparently oncologists can also do hematology stuff. So that's where I was sent. And they accept all insurances, which is great. Because that was my only concern is, will they accept my insurance? But they want patients to get the best care possible, so they accept all insurances. So they called me to schedule my appointment. And they said I couldn't get in until July 24th. And we are like, I cannot wait that long. I am severely anemic. But they said any doctor, they're all booked. So the doctor that we wanted to see, we know the neighbor of them. So my mom texted the neighbor and was like, is there anything you can do to get us in with the doctor? And he said, get there tomorrow morning before 8 o'clock. So we got in one day. So it was amazing. And so I saw the hematologist. He took one look at me and was like, you are very pale. You are definitely anemic. So he said, I'm definitely going to need an iron infusion. He was also going to test me for lupus, because there was something on my blood work that is consistent with lupus, but it could also be something else. It's just the most common thing with it is lupus. I don't think I have lupus. I don't know about lupus. I'm not worried about lupus right now. I'm just worried about the anemia. So he said I will need an iron infusion, and he was going to do blood work to make sure that was all I needed. And he said taking iron supplements is great, which that's what my primary care had prescribed. Taking iron supplements is great. It's just a matter of whether or not your body absorbs it. But with an iron infusion, it goes directly into your bloodstream, so your body absorbs it. So that is what we're doing right now. I am waiting for a call to schedule the iron infusion. And they are going to do it at a different office that is not as busy, because we were at the doctor's office for a total of 4 hours for the hematologist. So this other office, it should not take as long, but I have read an iron infusion can take anywhere from 15 minutes to several hours, because it depends on the type of iron you're getting, depends on how much iron you're getting, and you have to have this rate of the drip going into you, and then you have to be like watched for 30 minutes after to make sure you don't have a reaction. So the iron infusion, I don't know how long it'll take, being my first one. I'll keep y'all updated as usual. And yeah, I think that's all. It's a lot of information, a lot has gone on, seen a lot of doctors. Oh, one more thing. So when I was at the allergist, she wanted to do blood testing too for my immune system, because she's also an immunologist, I think, an immune system doctor. So she wanted to check on my immune system. So they called my mom. They may have tried me and not gotten me, so they called my mom. And that blood work came back, and my immune system is very weak, apparently. So she wrote a prescription for 2 vaccines that I have to get probably. I need to get them this week. We just made sure with the hematologist that wasn't going to be a problem with anything to go ahead and get them. So There's that too. It's like one thing on top of another. Severely anemic. Gotta get an iron infusion. Gotta get vaccines. Figure out what's going on with my asthma. And then my cardiologist, the nurse, called me again this week and was telling me all these numbers, and it's like, she left a message and she was like, I just want to make sure you got in with your primary care because you are severely anemic and it's because of your iron, and this number is this and this number is this, your hematocrit, your hemoglobin, your ferritin, and she's telling me all this stuff, and it's like, and she was like, just call me back to let me know what it is that you saw your primary care. So I called her and I was like, I saw my primary care. They referred me to a hematologist. They are getting me an iron infusion and all that. So, and I left her a message because it was after 5 o'clock. And she didn't call me back. So, anyways, it's a lot. And it makes sense why I'm so tired. This is also why my appetite is not back. And why I just feel a little weak and not like doing anything. So, I am still struggling with the pain in my neck and shoulders. My neck has been a little bit worse lately. So we are working on that still at physical therapy. I think that's all my updates. If I forgot anything, I'll update y'all next time because this video is already getting long. So, thank you so much for watching and listening. And until next time, never lose hope.